patients have been evacuated at Jane First Hospital in Limpopo. It's following a severe storm there. The heavy rainfall causing flooding and damaging the hospital last night. Let's get details. I'm joined on the line by Provincial Health MEC. It's Dr. Poppy Ramathuba who joins us. MEC, good afternoon to you. Can you give me a sense of the kind of damage to the hospital that we saw last night?
Good afternoon, and good afternoon to all your viewers. What we can indicate to you is that, yes, indeed, the hospital is completely damaged. There's no area except the mortuary for funny reasons that we can say it can be operational. As we speak, all our areas from admission, filing, casualty, the wards, our theatre, it is really damaged. We were with our head of infrastructure who was saying by just near looking, without even having to quantify and going into the details, he doesn't see us having to spend less than 20 million towards having to restore the hospital to get to its normality. And that is what has made us, of course, because immediately when this disaster happened, the important thing from where I'm sitting was that there should not be any staff member that gets damaged, injured, or there should not be any of our patients who will sustain any injuries as a result of this disaster. And for that, we are really appreciating to the support we got also from the municipality, the district municipality, that we were able to rescue those who were trapped in and evacuate all our patients to our nearby facility. Looking at Jane First Hospital being over 300 beds, we were able to, just for maternity only, we were able to evacuate 102 women who were in our maternity, because it is quite a very busy hospital. Yeah. Just to share with you, to show the business, that during this process, when there was the storm and the hail and also electricity cuts because of the challenges, our generator also was struck by lightning, couldn't kick. We had 9 deliveries in that hospital, 9 deliveries which were delivered by nurses using their cell phones as torches, having to cut an episiotomy using a candlelight. It really gives me hope that we still have the Florence Nightingale and the Cecilia Makiwana and the Mama Sisulu of today, who are able to understand that nursing is a calling and ours is to save lives. Despite the difficult situation they find themselves in, they were able to deliver 9 babies alive with an ABGA score of 1010. And that I'll continue to say bravo to them.
And I think many people, MEC, would agree with you. Dr. Ramathuba, as a doctor yourself, you've just been telling us about those moms who gave birth in those kind of circumstances. It goes to show the kind of nurses and the quality of nursing we have in this country. And I imagine with the repairs to your hospital, you're going to want that done as quickly as possible to get these top-end nurses up and working again in this facility. Have you got any idea when you may be able to get them back into this hospital?
Yes, our team is here in the hospital with me from the provincial office, the DDG responsible for hospitals and also the chief director responsible for infrastructure. We are now, the engineers are also on site to assess. We will be getting our contractors as from tomorrow, so that the immediate work of mopping up and cleaning, because sometimes it's difficult to assess the damage with the current situation that we find ourselves in. We can reassure, because they have given me an undertaking that by next week, this hospital, as I've indicated, it's one of the most busiest hospitals, and the people around here are so much dependent on it. If you can, notice that 9 deliveries in just one night in a district hospital, that is a very busy hospital. So by next week, we will be able to be up and running. We might not run in the complete full scale, but believe me, be rest assured, the team is here. We're not going to leave the whole weekend. They will camp here. They will be able to make sure that everything is fixed, because if we don't, unfortunately, next week we'll be having so many holidays. As such, contractors will not be able to buy the whatever will be needed. but we are saying those things that we can be able to access from tomorrow. Let's do that, and let's fix this hospital. What we are appealing to the community now is to say they must just bear with us. Anyone who is sick, visit your nearest clinic. Your nearest clinic will therefore refer you to another hospital. We have currently evacuated patients to St. Rita's Hospital, to Matlala Hospital, to the Lokong and Libuakomo Hospital. So we are saying don't come to Jane First Hospital. We are still, the hospital is still closed, but next week we will come here and indicate to you when are we exactly opening the hospital. But next week it will be functional.
Health MEC, thank you very much indeed, and congratulations to you and your team. In case you weren't able to hear part of it, the line was a bit up and down. They managed to deliver, if I heard correctly, 9 babies in pitch darkness last night, in and amongst one of the most severe storms in Limpopo. The hospital had been flooded, the generator had been hit by lightning, and they were delivering babies, these wonderful nurses, using the cell phone torches that they had on their own personal cell phones. That was Provincial Health MEC, Dr. Poppy Ramatuba, joining us. So currently, as she was explaining, Jane First Hospital in Limpopo is not functional. You will be redirected, if you're in that part of the country, to one of the clinics or hospitals in the area.